Does zinc supplements help your cold? Should you take zinc if you have cold symptoms? Well, I'm going to jump right into the answer. The answer is that studies are mixed. That's right. There are some studies that show that taking zinc may help shorten the duration of cold symptoms, may even reduce them. But there are many studies that show it just doesn't make a difference. The studies are mixed. Some say, yes, it works. Some say, nope, it doesn't help at all. But stay with me because I'm going to tell you some surprising information about zinc that you might not have known. I'm also going to tell you what to do with this information about whether you should take zinc or not, given what I'm telling you, okay? By the way, I'm Dr. Jen Caudle, practicing family physician. It's good to see you. First of all, let's talk a little bit about zinc, okay? You should know this stuff. This is according to the NIH. Zinc is found in cells throughout our body, okay? It really does help our immune system. It helps our immune system fight off bacteria and viruses. Our body also uses zinc to make DNA and proteins, which of course is very important. In other words, our body needs zinc to grow and develop properly. And you might have heard that zinc helps wounds heal. It's important for the proper sense of taste. By the way, this is going to come back around. But there can be side effects to taking zinc. Some side effects, guys: nausea, vomiting, diarrhea, stomach pain, lots of stomach stuff. You notice that? Also loss of appetite, that can go in there too. Headaches, dizziness, bad taste. And this is not all. If you take too much zinc, it can interfere with the absorption of copper, which is something you definitely don't want. Also, zinc can interfere with some medications. Now, that's not particularly surprising because we know that probably most medications and supplements do have some interactions with other things, right? That's just sort of how it comes. But this next thing is something you may not have known, and this is according to Up to Date, which is a medical resource that a lot of us doctors, med students, residents use, okay? This is what Up to Date says. They say that although zinc preparations may decrease cold symptom severity and duration in some studies, I added that because it's some studies, Up to Date does not suggest using zinc because of uncertain benefits and known adverse effects, particularly irreversible anosmia when administered intranasally. Now, I know you're probably saying, anosmia, what in the world is that? Let me tell you, anosmia is the loss of smell. And when they say when administered intranasally, what that means is when administered by nasal spray. In other words, nasal spray forms of zinc can cause temporary or permanent loss of smell. It's a big deal. In fact, Up to Date goes on to say U.S. Food and Drug Administration issued a public health advisory advising that over-the-counter zinc-containing intranasal products like Zicam, they use as an example, should not be used because of multiple reports of permanent loss of smell. Huge. This is a big deal. There are also other formulations that have been found to cause problems with smell as well, okay? A couple things you should know: zinc sulfate preparations that are syrup or lozenges seem to be better tolerated than some tablet forms. But the thing is, they can have some side effects as well, all right? They can actually have problems with bad taste, even nausea, things like that. And Up to Date goes on to say that because, honestly, they don't suggest using any zinc preparations because of uncertain benefits and known toxicities, including this irreversible loss of smell. This is a big deal, okay? And I wanted to mention this because you may or may not have known it. Now, when we talk about the studies that have been done, many of them have used the lozenges in the studies, right? But even the lozenges can have side effects: nausea, bad taste in the mouth, among others. So with this information, what do I think? Well, first of all, I think that the nasal spray version of zinc is like a no-go. If there's a chance of permanent or temporary loss of smell, I'm not recommending it to my patients. I'm not trying that to myself. No way. Regarding the other forms, the lozenges and things like that, remember that the studies that we have are mixed, meaning if you take a different formulation, there's still this chance that it might work or it might not. And given the potential side effects of even things like the lozenges, my feeling as a family doctor is, you know what? I don't know that it's worth it. I would actually just recommend my patients use supportive care: fluids, rest, chicken noodle soup, all that good stuff, okay? Saline nasal spray. Saline is fine. Other things to help with your cold and cough symptoms. I would say, just in all fairness, that there are probably some people who could try like a lozenge and probably be okay. But based on the potential toxicities that we know about, I would say that you need to talk to your doctor before you do anything to make sure that you're not on any medications or have any underlying medical conditions where your doctor would say, I don't think you should be taking this. Okay. So that's super important. Is it a no-go for everyone? It's not. But if you are interested in taking it, you should talk to your doctor. For me and my patients, what I'm recommending is good old supportive care. And for me, I'm going to hold off on the zinc and definitely holding off on the intranasal or the nasal spray forms of zinc. That's just me. Check with your doctor to see what they say and what they think. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. I do daily health videos. Please, on Facebook, like and follow my page. On YouTube, please subscribe to my channel. Click the little bell for updates. I'm also on TikTok, Instagram, you name it, at Dr. Jen Caudle. Also, go to my website, drjencaudle.com, to sign up for my free health newsletter. Yeah, check with your doctor. Get more information from your doctor. But this is my 2 cents. Guys, I hope you're well. Talk to you soon.